Hello and welcome to our webinar. Our topic today is Cortica's new location in San Diego, Mission Valley. We have invited physicians from all over San Diego to attend this webinar. Thank you for taking the time out of your day to join us. Our speakers today are Dr. Suzanne Goh, co-founder and chief medical officer at Cortica, and Marianne Bernaldo, area director at Cortica. My name is Courtney. I am your host today, and I'm joined by a team of moderators who are helping to run this webinar. Attendees are muted during this session, so if you have a question, please enter it at any time in the Q&A panel of your Zoom control window. Our moderators will read them aloud at the end of this webinar, and a member of the Cortica team will provide an answer verbally. The attendee list is private, and this webinar is being recorded. So a link to the recording will be emailed to all registrants after the webinar. Today, Dr. Goh is going to talk about the Cortica care model and our new center located in Mission Valley. Then Marianne is going to talk about how a family can get started at Cortica and how to refer a patient to us. After that, we have reserved a few minutes for questions. As I previously mentioned, please enter your questions at any time into the Q&A panel on your screen. I'll now hand the microphone over to Dr. Goh so she can get started with our presentation. Over to you, Dr. Goh.
Great, thank you. So I want to thank you all for joining. It's really a pleasure to be with you, and thank you for your interest in Cortica. I'll start off just with a quick overview of our care model at Cortica and why we've designed our approach to care for autism and neurodevelopment the way we have. This slide is one that demonstrates what I think so many of us are familiar with, which is the state of fragmentation of our current healthcare service offering to children with neurodevelopmental differences, including autism. And so a family that receives a new diagnosis is really faced with a pretty overwhelming set of choices and decisions to make regarding therapies, appropriate schooling, support for the family, medical care, and the list really goes on and on. So what we've tried to do in establishing Cortica's care model is to address this problem and to provide a better solution. So what we've created and designed is what we think of as a comprehensive family-centered approach. And our goal really is to prepare children with autism and related neurodevelopmental conditions for appropriate education, engagement in the community, and participation in the workforce by focusing on all the areas that we know are important for the success of a child who has a neurodevelopmental condition. And that would include appropriate medical care with a focus both on neurological diagnosis, testing, and treatment, as well as thinking about health more broadly in terms of aspects of health like nutrition and general lifestyle modifications, sleep, a range of comorbidities, including GI disorders and others. The second major domain is behavioral, where we think about all of the different modifications to the environment and to interactions with important people, including caregivers in the child's life, that can help to foster optimal growth and learning and development. Sensory motor challenges, including, for example, difficulties with sensory processing, sensory integration, and then motor praxis, communication, of course, and then social and emotional development. And these 6 rings you see here are just one way that we have of depicting the different domains of development and family support that are really important for the success and for these children to be able to realize their full potential. We diagnose and treat a range of different neurodevelopmental conditions that are listed here. We really think of our services as being appropriate for really any condition that impacts brain development or brain function in children. And we do treat individuals with neurodevelopmental disorders with the goal of helping in childhood, adolescence, and setting up these individuals for success in adulthood. So the conditions include developmental delays, autism, intellectual developmental disorder, cerebral palsy, the consequences of prematurity, speech language and developmental motor disorders, a range of learning disabilities, ADHD, as well as a brain injury, neurogenetic syndromes that have a neurological component, epilepsy, tic disorders, sleep disturbance, and other neurological conditions that affect development and behavior. And what this translates into is a set of comprehensive services that includes neurological care, EEGs, family counseling, which includes individual, couple, sibling, and family counseling. We have nurse practitioners and a registered dietitian that provide nutrition consultations. We have designated feeding therapists. Our applied behavior analysis program is probably the biggest program that we offer, and that has the largest staff at Cortica. Within our ABA program, we offer a preschool group program that aims to allow preschool age children to develop the skills needed to enter mainstream kindergarten. We also offer occupational therapy, speech language therapy, physical therapy, and music therapy. And we're really excited that our Mission Valley office is now open. So we think about our Mission Valley site as an extension of our larger Sorrento Valley location. It allows us to reach more families across the San Diego County. And we currently offer in-center and in-home ABA therapy services, and our OT and music services will begin this summer. Speech therapy and physical therapy will follow soon after. And our Sorrento Valley location will continue to be our largest site in the San Diego area and house our neurology services and family counseling. All medical appointments will be scheduled through our Sorrento Valley location, but with a range of telehealth options to reach families across San Diego.
Good afternoon, everyone. So now I'm going to talk about how to get started at Cortica. We have two processes and procedures on how a family can get started at Cortica. Our first process is what we call our standard process, in which a patient is scheduled with one of our pediatric neurologists, which then results in a neurological developmental evaluation. And then from there, recommendations for ongoing therapy are provided during that time. Our second process is our direct to therapy, which has the patient who already has the actual referrals for therapy services that are existing, and then they can proceed directly to therapy evaluations and from there begin therapy services. We accept a wide range of insurance options at Mission Valley, from Aetna, Anthem Blue Cross, Beacon Health, Blue Shield, Cigna, ComPsych, HealthNet, Kaiser and select ABA markets, Magellan, MCCP, multi-plan options, Optum, Scripps, ACO, and United Healthcare. Again, this list is subject to change. We also accept self-pay program plans for families whose current insurance is not currently accepted at Cortica. And we offer multiple options on how to refer a patient to Cortica. You can always go on our website at corticacare.com. We also have a link on our website where we can refer a patient directly. We also have a number for our enrollment team, and then you can also send us a fax and the enrollment team will follow up to discuss further details.
Thank you, Marianne, for that information about how to get started at Cortica, and to you, Dr. Goh, for covering our unique care model and the details about our new location in Mission Valley. So we've reserved a few minutes for Q&A, so I'll turn it over to our team of moderators now. Jensen, do we have any questions from the audience?
Yes, we received a question from a doctor in the audience who asks, does Mission Valley offer all the same services as Sorrento Valley?
I can answer that question. Eventually, we will offer the remainder of the DT services, which will be, we discussed in the previous slide, speech therapy and physical therapy. Currently, right now, we have music therapy and occupational therapy services that have started, as well as ABA. So eventually, the rest of the developmental therapies will be offered at Mission Valley as well, with a time frame of August to September for the remainder of those services.
And it looks like we've received another question from a physician. He asks, does Cortica do diagnostic assessments?
I'd be happy to answer that. So yes, we do. A child does not need a diagnosis prior to coming to us. We perform, when appropriate, the Autism Diagnostic Observation Schedule, or ADOS, the Autism Diagnostic Interview Revised, or ADIR, and then we also do the Childhood Autism Rating Scale. We do other sort of standardized assessments as well that help with diagnostic clarity. So, questionnaires, really the gold standard diagnostic tests for neurodevelopment, autism, ADHD, sensory processing, and others. So families, we really welcome children who do not yet have a diagnosis, and we can provide really a range of diagnostic tests to help arrive at the most appropriate diagnosis. If there's anything that requires additional testing, we would of course refer out as appropriate.
Another question we received from a doctor is, what age ranges do you treat?
So our age range for new patients is 21 and under. So all individuals up to and including age 21 can enroll as new patients with us. And then we do continue to treat individuals who have come to us age 21 or under. As long as we feel that our services really best meet their needs, we do continue to treat them into adulthood.
That's all the questions we have. So thank you to our audience for sending those in. If you think of a question later, physicians can always reach out to us through our website at corticacare.com/refer a patient. Thank you for joining us today. We look forward to caring for your patients.